This is a surgical instructional video using sawbones on patellofemoral joint replacement. There are two important lines that has to be drawn. One will be the white side line and the other is a line perpendicular to the white side line. So basically that is what has been drawn here. As you can see, this line here is the white sides line and this is a line perpendicular to the white sides line. So the entry point is 1 centimeter above the insertion of PCL. So that will be the starting point. The entry point for the IM rod. So we drill at 1 centimeter above the PCL insertion. Open that. And then we insert the anterior resection guide. So the anterior resection guide enters. The stylus will be adjusted to sit on the lateral facet. So this would prevent notching. So as you can see, the boom of the stylus can be adjusted from this knob. This knob will translate the resection anteriorly and posteriorly. So this stylus sits on the lateral facet. So once that has been done, the guide has to be adjusted to the proper rotation. So based on the anterior reference line, it is rotated to the white sides line. So as you get these lines parallel, the pin is fixed. An angel wing is used for us to ensure that we are not about to notch. Anterior resection. The next step is to select the appropriate size based on the resection that has been done. So the next step is where we use a milling guide. So in the milling guide, there are slots whereby the milling can be done and to secure screws. And this aspect of it is the feet, which will be sitting on the resection level. Okay, so it is placed as such that the central track is along the white sides line, and you can err towards slightly lateralizing it. And what is important is the feet should be sitting and it should be placed in a set position. Once we are happy with that position, the screws are inserted, starting with the oblique screw first. So the first step is to place the oblique screws, followed by the lateral screw. It's important not to over tighten first at the first go. So we insert the lateral screw and followed by the medial screws. All screws are inserted so that the milling guide is firmly stabilized. The next step is for us to start the burring process, which will be start with the central track, followed by the lateral track, subsequently the medial tract. Okay, in order for us to burr the lateral and the medial track, the feet needs to be raised. But when we are starting off with the central track, both feet should be seated on the articular cartilage. Priority will be to ensure that the tail does not encroach into the intercondylar notch. The process where we burr, the slot has to enter into the track and it has to be parallel with the track. it should not tilt. If we tilt, there will be some resistance in the process. So the process starts with the central track, then you remove, then we start back on the lateral track, we go all the way down, and then it's important to keep the feet open so that the burr can be translated to the lateral and medial aspect. Once that is done, the feet is pushed all the way down in order to stabilize it, and the same process is continued over the medial aspect where the burr is engaged into the slot down. Complete the central track. Let the burr run. Then you exit the central track. Once the central track has been done, you enter into the lateral track. Same thing, run the burr all the way, and then stop. As you reach down the feet, lift the feet up so that you open the track so that you can run into the lateral aspect and the medial aspect of the lateral track. Once that is done, you remove it, push the feet all the way down into the bird surface so that stabilizes the jig, and the similar process is started on the medial track. So we run the burr, lift the feet up, open the slot, following which we take the corresponding the pec drill guide and insert that to the bird surface, and this will be again secured with 3 screws. One, two, the drill for the pegs are done. It is important that we drill all the way in to the third. Okay, the last will be for the tail. You start over the medial aspect, drill it all the way down, and then you translate it laterally. You drill over the medial aspect and is translated laterally so that the entire trough is made for insertion of the tail. Final step is to insert the trial implant. We have to make sure that the pegs enter parallel to the slots that has been drilled. You don't want to flex the component or extend the component, so it has to be driven parallel so it can be malleted down.
Kaji lah.